Testosterone can help with mental health, depression, psychosis. It's not just produced in the testis and the ovary, but testosterone is also made in our brains. We need to be thinking about our hormones in the same way that we think about thyroxine and insulin. They're essential hormones for our health. If a man has a synthetic testosterone, they will become infertile.
What is the problem with hormone treatments?
Where do I start, James? Just the word hormone. Like, what is it? What does it mean? What does it mean to you?
A chemical signaling compound.
So it's confusing, isn't it?
Yeah.
And you know what? I was talking to my mum a few years ago, and she's like, Louise, I don't think people know hormones are produced in our bodies. It's like, of course they do, mother. And then I think, actually, I don't think people do, because as soon as you talk about hormones, that's when people think that's tablets, that's injections, that's gels, but actually a hormone is just a chemical messenger that is produced by various tissues, organs in our body that go to every single cell in our body. And we've got hundreds of hormones. Some we know about, some we don't. But when I talk about hormones, everyone thinks it's all about HRT. But as a doctor talking about hormones, I could be talking about insulin or thyroxine or adrenaline or serotonin. These are all hormones, but we've just forgotten about those somehow.
And then even if we wanted to talk about the body's own production, whether it's endogenous and external, exogenous, these are big complex words.
Yeah.
I had to think then. I had to look at the table to
Very
make sure I
good.
didn't get them the wrong way around. So even then, these are the kind of words that just shut people off.
Yeah.
Someone goes, if you lost a bit of weight, you could improve your endogenous production, and they're lost.
Yeah, totally. And even at the beginning, you said synthetic. Now that's really confusing, even for a lot of doctors, because if I talk about hormones, as I've said, people think about HRT, yet what about contraception? Everyone knows their hormones, but they are really synthetic. But when I say to doctors, the difference between the synthetic hormones in contraception and natural hormones in HRT, and they're like, oh, Louise, you've lost me now. What? It's not that difficult. But it is if you've never thought about it.
And it's something so mainstream as well where, if you were to talk to a 16, 17, 18-year-old, are you on the pill? And this could be a discussion someone's having within the first few years of being sexually active.
Yeah.
It's just considered normal.
Yeah, I know.
But yet, I don't think people, I suppose that'd be quite a nice place to start. When it comes to contraceptives, people just think it's a pill you take, you don't get pregnant. But this is causing a cascade of hormonal changes through the body to not just fertility, but there can be other adverse side effects. And over the last several decades, we can get to a point now where we can say these are relatively safe, but there's been a pretty chaotic past to contraceptives.
Yeah, and it's really important to talk about this. I've got 3 daughters, so I'm really aware of their future health. And as a clinician, I'm really wanting to prevent diseases. It's all very well treating diseases, but actually it's a lot better if people don't have diseases. I don't want to see people to give them more and more tablets. But, the history of contraception, I think, is really interesting because when it came out in the 60s, it wasn't actually marketed as a contraception. They didn't do studies as a contraceptive. All the studies were on bleeding and trying to reduce bleeding in women. So the studies were all done on the womb. They did a few studies on people abroad in Puerto Rico because they thought they would be easy to study. And a lot of those women had clots, strokes, some of them died. They ignored that data because they wanted to get it to market. So when it first came out, it was a tablet to help heavy periods. And then they said, by the way, you might not get pregnant on it, because they tested it on some women in fertility clinics and their fertility got worse. So the women were like, great, sexual liberation, that's great, I'll take this. But after a year, the drug sales went up. So they went, okay, let's just add on the licensing for contraception, and sales doubled, and the rest is history. But if you look back in time, lots of people were really ill, actually, and the clot and everything else. So they've reduced the dose, and they've reduced the formulation, and they're always bringing out new, but they're still synthetic, so they'll block the activity of natural hormones working in the body.
I think even, not to get too tangent on that, but finasteride, which men are taking for hair loss, I believe was a prostate drug.
Yeah, it was.
So you had all of these older men with maybe prostate issues, and they start giving them the drug, and suddenly the hair starts becoming a bit thicker.
Yeah.
If you were to ask someone about finasteride, they would say, no, this was made for people's hair.
Yeah.
But
And that happens a lot. Look at Viagra. Viagra wasn't made for erectile dysfunction. It was made as a heart and a lung drug, but the people in the studies were getting erections, so they went down a different path. But that, again, is a shame with Viagra, because We know it helps nitric oxide production. It's a really beneficial drug to reduce cardiovascular disease, diabetes, Alzheimer's, low dose taken every day. But, people go, oh, no, but that's just for erectile dysfunction. And that's the same problem with hormones. People think it's just for hot flushes if I prescribe HRT, and of course it's not. But it's really important that we understand the basics, because my work is really just about giving choice and allowing people to have education, because for so long it's just been hidden. I took the contraception for about 10 years, James, and I really regret it, because I didn't realise, and that's me as a doctor, because I thought it was just a hormone and I didn't want to get pregnant as a medical student. But to give a healthy person a synthetic drug, you have to question, is it the right thing for all of us just to blanket being given it?
We then have an ethical kind of dilemma where the burden of pregnancy is always falling on the woman. Are you taking the precautions to make sure we don't have an issue?
Yeah.
And I think there's some naivety to that where, if there was a pill that men could take that would make them infertile, or even like finasteride, which I believe can have an impact on fertility, it'd be a bit weird. I think there'd be a bit of pushback if they were like, you should take a pill.
And there's a study that came out recently showing this new drug that might be contraceptive for men, but it was a really small study. And not being funny, I don't know really whether men would take it. But also, contraception, like I say, was tested on the womb. Where are the studies looking at its effect on the heart, on the brain, on the rest of the body, which is really important? We know that people that go on the pill have a higher risk of heart disease. They have a higher risk of clot. They have a higher risk of breast cancer. But that's not really spoken about because, your risk is low because you're young. But, one of my friends, his girlfriend died of a clot when we were medical students, and she was otherwise fit and well, and it was contributed to her contraceptive. And it's always stuck with me because that family have been ruined forever. And you can't prove it was that, of course, but we know that the risk increases. It's well documented, so I'm not saying anything that's controversial. It's out there. But when so many people take the contraceptive, you say, well, it's only a small percentage. But a small percentage of a large number is still people's families, where there are choices. As a woman, I can decide about what other risks, precautions to take. Contraception is not just the pill. Do you know what I mean?
Yeah, you can have condoms. You could be maybe even strategic with sexual planning around the time of the month. Yeah. Do you know what's interesting? I know this is a bit vulgar to discuss on a podcast. I only at 36 years old, for the first time, asked my fiance about having a period. I had no idea how often you would need tampons. So as a boy, I think you just think, they just have one for the period. And my fiance was like, no, you need to rotate them like every few hours. I was like, what? Yeah. Every few hours? And then I never heard of toxic shock.
Yeah.
I was mortified. Yeah. And being a man, I know that throughout a lot of the discussions we'll have today can seem like a much simpler existence when it comes to having, pregnancies, well-being, composition, the lot. But the fact that there's having so much that has to go on around that stage is absolutely bonkers.
Yeah, my daughter, my middle daughter, in fact, she was on my podcast recently, Sophie. When she had her first period, she came downstairs. I just remember so vividly. She sat on the sofa and she went, I can't do this every month. Like, how do people even go to work? Like, it's awful. Like, it was just like the most catastrophic thing because there was the pain, there was the bleeding, everything else. And then I was doing some volunteering work in prison last year, and a lot of the women have really heavy periods, and well, they do anyway. But in prison, and they asked one of the people looking after them if they could just have some sanitary protection, and this warden just gave her one sanitary towel, and they were all like, what the hell? Like, that's not going to help. But again, it's this misconceptions that women go through. But again, some people take contraception for periods, but there are other treatments, there are other choices. We need to be looking at what else is affecting their hormones as well.
I hope you're enjoying the episode. For any of you that may or may not be aware, I'm on a mission for men to get their testosterone levels checked. So if you're someone that's curious about where you're at, head to checkyourbloods.com and I'll give you all the information that you need. One more time, that's checkyourbloods.com. Right, let's get back to the episode. There's an interesting discussion with this. I didn't think we'd be going so heavily into the menstrual cycle so early, but looking at sport performance.
Yeah.
So my partner, for instance, hated being on contraceptive pill because she could feel the impact of it on her performance. Yeah. You'll know better than me about potentially some contraceptives reducing levels of testosterone, which can have a massive impact on the brain. However, then on the other end of the spectrum, we have women manipulating their menstrual cycle to discontinue it so that they don't have to go through the peaks and the troughs. Yeah. What can people learn and understand from kind of both ends of the spectrum?
See, you've brought out so much, and it's really important because, as a woman, I want my brain and body to work. I didn't want to get pregnant when I was younger. I want to be really healthy now and balance my hormones. But it's about our physical and mental performance is crucial, and they are really linked with hormones. So contraceptives, as you know, will increase sex hormone binding globulin, reduce freely available testosterone, the combined contraceptive pill. Other pills or the implants will actually give people a chemical menopause, so they'll block they'll block the ovulation, so you won't get the peaks and troughs of hormones, but they'll be low. So the normal hormones will be low, same as menopause. So no wonder people feel more tired, they can't exercise, they have low testosterone, low estrogen, low progesterone. So they're sort of wading through treacle a lot. And then other people who are athletes, they get variation because the graph where our hormones fluctuate throughout our cycle. Before our periods, our hormone levels really drop. So when they really drop, often people feel awful. And then they might get, like you say, a heavy period. Now, if you're an elite athlete and you've got your race on that day, what are you going to do? Not only might you flood and have a really heavy period, but your muscles won't be as strong. Your brain won't be as good. Your stamina won't be as good without those hormones. And so many people, and I read it on various platforms, are like, oh, those few days before your periods, maybe you could just meditate and do a bit of self-care and whatever. But actually, no, I want to go to the gym. I want to feel really good that day. And a lot of people we see have these hormonal shifts. They have symptoms. They have premenstrual syndrome, PMS, or premenstrual dysphoric disorder, PMDD, which is a more severe form. We just give them some hormones, top them up with natural hormones, not contraception. And they're like, wow, I can perform every day. But this brings up another conversation about testosterone and athletes, because elite athletes are not allowed testosterone, even with a medical exemption.
Don't let me forget to ask you about amenorrhea. But when we're looking at the menstrual cycle, hopefully this could be a segment that women can make sure that the men listen to. We can break it down, and correct me if I'm wrong here at any point. Ideally, 28 days, let's say, roughly. And in the middle, we're looking at ovulation. We have the follicular phase to begin with.
Check you out, James. This is very good.
Luteal phase in the second latter part. Now, some people would look at those as 4 different physiologies. We're moving through the menstrual cycle. Now, on top of that, most research is done in men because of this, because we can have these varying...
Hormones interfere.
And then even things like this from my PT days, we would get women to measure week 1 versus week 1, week 2 versus week 2, because their weight, their strength, all of these things can fluctuate between menstrual cycles. Now, one of the biggest things, like you say there, it's not just strength and how people feel. It can be even coordination, balance. And it's very difficult for a trainer to say to someone, oh, you should be sticking to free weights here and you should be using machines here. Am I right in thinking, when I first made videos about this, when I was learning about this, maybe in 2017, 2018, then we started to see this big reign coming back where coaches and evidence-based community were saying, actually, let's not talk about this because you're almost putting it into a women's head. And the variation and fluctuations in the effect is so vast that what we shouldn't be doing is saying to a woman, oi, you're luteal phase now, so go do a machine-based workout because you're going to be weak and uncoordinated. There was a lot of pushback. For someone out there that maybe doesn't understand the menstrual cycle or isn't quite aware of where the peaks and troughs are, is that true that we should be... What the issue I don't want to get here is giving someone like the nocebo effect of saying to them, you will feel this way.
Yeah. Do you know what? Women are gaslit the whole time, and I don't think women make up their symptoms because a PT, a doctor, someone tells them you're going to feel like that. We often think we do because someone's told us, but actually internally we know it's happening to us. So I wouldn't worry that PTs are doing that. I think it's great people are thinking. But this might sort of blow your mind a bit, but evolutionary, women are designed to be pregnant and be pregnant most of their fertile life. When we're pregnant, our levels of hormones are in the thousands, tens of thousands. They're really high. So if you think in the Victorian times, we were pregnant, women would have 10, 12 pregnancies. Not all would end in a live pregnancy, but they would be pregnant a lot or breastfeeding a lot. Now, women have loads and loads and loads of cycles. So you've got this, like you say, up and down, but the up is still quite low compared to pregnancy. So our bodies as women are not designed to function on this low level. So which I think is really interesting if you think about hormones and what we're doing and what we're giving. And then so many women, like you say, are on contraception, so they're even having lower hormones. We've got a lot more inflammation in our diets. There's, a lot more endocrine disruptors, which are probably affecting women's hormones as well. But what I worry about as a doctor is that these symptoms are normalised. It's like, oh, don't worry, you will feel bad because your period's about to come. Well, actually, as a doctor, I can just balance those hormones and then you won't be feeling like that. And your periods will probably be lighter because you won't have the hormonal changes and your hormones will be more balanced.
Don't let me forget to get into endocrine disruptors. So if we were looking at someone in a sport performance setting, would you be able to, quote unquote, balance those hormones without pushing them into the realm of potentially being caught doping?
Yeah, well, yes, there's two things here really. So athletes, extreme athletes, elite athletes are allowed estrogen and progesterone. What happens a lot with athletes, especially if they have heavy periods, then they're just given the contraception, which often can negatively affect their performance. So I see a lot of young women in the clinic, and I'll often, after taking a careful history, making sure there's nothing else going on, will give them the right hormones they need. And sometimes it's for a few days, sometimes it might be for the whole cycle, but natural hormones. So I'm just replacing like with like. A bit like if you had an underactive thyroid and you were just feeling more tired, I'd say, well, I'll just give you some thyroxine, James, and replace what your body should be producing. Same with natural hormones. And then the women go, wow, God, I feel the same every day of my cycle. Is this legal? Am I allowed to feel like this? Yeah, of course you are. And then they're back. They don't need a PT saying, oh, your period's about to come, you're going to feel a bit bad, don't do that, weight class or whatever. And that's where we should be moving towards, women knowing that there's a choice, because it's not just sport. I see women with PMDD and they can't go out the house 3 days a month because they're suicidal. They can't go to work. They can't function. And this is common, really common. About 1 in 20 women have PMDD. 95% of us will have some PMS, but it's just normalised. Menopause is normalised. Everything's just like, oh, they're there, dear, don't worry.
Or even worse, you could say that someone out there could be like, oh, my missus is mental.
So in this episode, you may have heard Dr. Louise Newson mention PMS and PMDD. PMS stands for premenstrual syndrome. This could be irritability or bloating and some of the less severe side effects of the menstrual cycle. PMDD can be a lot more intense and can disrupt a lot more in someone's life, such as their relationships, their work life. And PMDD is recognized as a genuine mental health condition. I hope that clears things up and we can get back to the episode.
My oldest daughter's a musician and she plays with all sorts of aged people. But, every so often she's texting me and going, oh my God, I've just found out my friend who's 22 like her is on lithium. Another one's on olanzapine, the antipsychotic. It's got to be her hormones. When I talk to her, it's just those few days before. She's not coming into rehearsals. It's like, what's going on out there? It's when it's just basic physiology we're just supporting.
And really, if there was more nuanced and spoken about, an understanding of this. And again, this is why I always want men to understand a bit more, because it's your quote to say that everyone's life has a woman in it.
Yeah.
Whether it's a mother, a sister, whatever.
Absolutely.
And we need to kind of coexist and understand, not have things that can push us further apart. We touched on to endocrine disruptors. And again, when we talk about endocrine, a lot of people are going to go, what?
What's going
on? We're looking at things that could disrupt hormones.
Yeah.
And now when I first saw this and I looked into it and people said, I thought the tinfoil hat was going to be on, don't touch receipts, there's contraceptive pill in the water, filter your tap water. What kind of impact is the environment having, plastics having? Yeah. Is it notable? Is it concerning? Talk to me about where we're at.
Yeah, I'm not an expert in this. And actually, once I start reading it, I go down such a rabbit hole and then you don't know what to believe, but it's quite shocking, actually, some of the things. And even like the hormones in water, that is actually a big problem with contraception because it's synthetic. Ethinyl estradiol is the synthetic estrogen that's given. So it doesn't get metabolized in our body. So it's not natural, so the body just wheezes it out. Then it goes into the streams. The fish don't know what to do with it. They're gobbling up, and it's the synthetic hormones that are the problem. It's not women like me on natural hormones that are having a wee with, because my hormones are metabolized in my body. So that's a real problem. But then, like you say, the plastics, the pesticides, we don't really know. That's the problem. I don't think there is a simple answer because no one's really testing.
It's hard to distinguish these from things like also obesity.
Yeah. I'm very interested in inflammation. As you might remember, I've got a pathology degree as well, so I'm quite geeky into science and we can talk a bit more about it. But we need a bit of inflammation in our body to protect us, but we've got a lot of inflammation from what we're eating, what we're drinking, or processed foods, lifestyle, not exercising, all sorts of things. And that will have an effect on hormones too, which, everything in our bodies, our bodies are amazing, but they don't work in isolation. And I think hormones have just been seen as a lifestyle thing. It's a nice to have, not a need to have. And we need to be thinking about our hormones, or our estrogen, progesterone, testosterone, in the same way that we think about thyroxine and insulin. They're essential hormones for our health. And different things externally and internally will affect that balance.
So it's interesting you say, if you were to explain inflammation in the most basic of terms, what is it?
Okay. So if I cut my finger and it gets a bit infected, I don't know, rusty nail or something, you could probably visualize the cut, you can visualize the swelling, bit of redness, maybe a bit of pus. So my body is detecting something's not right. So there's lots of, our body's incredible, but the tissue produces like some sort of magnet proteins that go, oh, come here, come and help. So you've got these white cells, if you heard of white cells, like neutrophils, will come and they'll try and gobble up any of the sort of the infection that's brewing, any of the inflammation. But because there's so many cells there, they're producing chemicals that try and kill the area, the damaged tissue. So you get some swelling, you get some redness. If I'm really healthy, that should go quite quickly. If you've got diabetes that's uncontrolled and you're not very healthy, you could get an infection of your finger, you can end up with sepsis. So that's an overwhelming inflammatory response. So you want to have some inflammation or some anti-inflammation in the body to stop it. So there's this really fine balance. So you want your inflammatory cells, they're ready. It's like, we always think about it like you're holding a shield. You've got some things coming to attack you and you need that to protect us, but you don't want it to be overwhelming and you lose your shield and that's it. So constantly throughout our body, it's any cells that are damaged, that are repaired, like, you've eaten food that perhaps you shouldn't, you've got more inflammation in your body, you want these cells to reduce that inflammation, calm it down. But they don't want to stop the inflammation because you might just have a tiny cut and that's it goes wrong.
Because there's a lot of people that think that, okay, inflammation's bad, so therefore I'll do an ice bath, it's anti-inflammatory. I often say that everyone throws around antioxidants without knowing what oxidation is.
Yeah.
Then, again, another tangent's where my mind goes, a lot of people seem to think they can just take anti-inflammatory pills, and sometimes they take it for a long period of time.
Yeah.
Now, this is my little tinfoil hat thing. If I roll my ankle or sprain my ankle, I don't take anti-inflammatories because I'm thinking that I need that inflammation for the healing process. Even when people say, oh, ice an injury, I'll ice it at the beginning, but some people will then get heavily on taking pills to reduce inflammation. But surely if that's part of the healing process, where are we at with that?
It's a really, really great question because, obviously I prescribe drugs, but I learned so much about how these drugs work because you have to, as a doctor, know what's going on. Anti-inflammatories, steroids, the biologic agents, they have a role, but long term, if they're constantly suppressing inflammation, it's not good because we'll have more inflammation in our body that we can't control. Now, inflammation isn't just a cut, an infection. Inflammatory diseases are killing us. So the number one killer of women globally is cardiovascular disease and dementia. These are inflammatory conditions. Type 2 diabetes, osteoporosis, mental health, Parkinson's disease, non-alcoholic fatty liver disease, cancers. These are all related to inflammation. And if we haven't got enough anti-inflammatory in our body, that's going to affect us. But if we're having too much anti-inflammatory, we're not going to protect ourselves. Do you see what I mean?
Yeah, and there's so much to unpack here as well. The thing is, if we look at stigmatization, I haven't forgotten about amenorrhea. The stigmatization of hormone replacement compounds, testosterone, estrogen, progesterone, we look at those and people go, oh, these are bad. They tarnish it with a really bad reputation. But if we look at paracetamol and we look at anti-inflammatories, these are not without risk factor either. And I know people, very well-known, respected influencers that for whatever reason had it in their head they should be taking an anti-inflammatory before bed, and they developed bladder issues and other issues with it. And what annoys me is that if you reach for a packet of those, people go, oh yeah, that's fine.
Totally.
But the amount of stigma that I've received since going public about taking testosterone is hatred that you're getting.
Yeah.
But I say to these people, although the standards are a bit different, because if I was to become a type 1 diabetic at 36, which is very rare, I wouldn't get performance enhancing benefits potentially out of it. Because, oh, I now take insulin. People are like, yeah, we don't care. But after having low testosterone myself about a year and a half ago and taking testosterone, everyone cares and they're annoyed. They're thinking, oh, you're an idiot. You shouldn't be giving young, healthy people, but they can't even describe, it's not even just about objective health. And I actually said, I did a post about this. I said, technically, I was fine when I started using a TRT service. Technically, I was fine. Because as far as health metrics and my GP, if I've got low energy, low libido, I'm tired and I've got low drive for life, that's probably not going to put me into the doctor's clinic for 20 or 30 years. I'm just not really reaching my full potential. But I cannot believe that we get such stigmatization on this side, but not on the other side. Why is it that people get so emotive and, dare I say it, angry or triggered when we look into the realm of, hormones as a whole? Is it because feeling better, potentially looking better? Because these hormones, when given to people correctly, even if just taking someone back to baseline, will potentially improve their composition, will improve their sporting performance. Is it that? Is it jealousy? Is it stigma? What is it?
Do you know that there's so many reasons actually, and it's great that you're asking. And I wish I had a simple answer because there isn't one simple answer. Some of it is because they're wrongly labelled as sex hormones. So does that mean you get better sex? Or is it because you're male and I'm female? Is it gender? But it's neither actually. And it's because when they were discovered, they firstly knew that there was something in a woman's ovaries that was affecting them. They discovered estrogen and progesterone. And then they discovered testosterone and they made that label testes. So initially it's just labelled as a male hormone, even though in 1938 they discovered it was in women too. But before they even knew about hormones, they knew there was something in the testis. They knew something was in the ovary that was helping people. So if you go back in the history of time, there was a Dr. Brown Sequard, who was a very well-established doctor, very well-respected. He knew that there was something in the testis of men, but they didn't know what. So he actually used guinea pig testes and ground it up and took it himself when he was in his late 60s, 70s. And he called it the elixir of youth. And he writes, if you read his diaries then, saying about how he could get out of bed, he didn't have muscle and joint pain, he had joy for life again, he could look at his academic texts, and it was amazing. Now, people thought he was mad, because it does sound a bit mad, doesn't it, grounding up guinea pig testes. But once they discovered that it was a hormonal thing, they still thought he was mad. But other people came to his clinic and took this hormone, and they said, wow, we're feeling the same. And there was a couple of other doctors that did similar. But the medical establishment didn't like it, and they reported him, and he was ostracised from the medical community. And it was so sad for someone who actually really wanted to help people and found this discovery. But it was almost like you say, James, because it was feeling better, it's quite hard to measure. Whereas if you've got a rash, I can see whether it's getting better or not. It's more objective. But a feeling better thing is a bit subjective. So over the decades, people have tried to say it's all placebo, for men and for women. But then when they realised that it was this hormone testosterone, they wanted to make it marketable. Now, you can't market your own hormone. They tried initially to get testosterone from urine of men, but you had to get huge volumes. So actually, in the early 1900s, they used prisoners, and they were going around at night time, like getting urine from male prisoners, but they still had to have a lot to make it. So the pharmaceutical companies, the chemists got together and they made a synthetic testosterone. This was a real problem because it's been chemically altered. So if you think about roast chicken, I give you a roast chicken, you can know it's got chicken meat. If I give you Chicken-Flavour crisps, does it have any chicken in? Probably not. Is it going to be the same beneficial protein? Of course not. So they're making the Chicken-Flavour crisp version of testosterone. And then people started using it more and more because they could make money. The pharmaceutical companies made money, pushed it out. And you probably know more than me, there's like loads, dozens and dozens of different synthetic testosterones available. And a lot of them have been abused for sport. They've been abused by all sorts of people. They've still had benefits, but they've had risks. So they've had risks of heart attack. Some of the people have really weird muscles and will probably be enhancing sport too much, rather than taking you back to what you would be. So it's given testosterone a really, really bad name. Even in the 1940s, they did studies in women and men on testosterone and showed that women's well-being was better, their cognition was better, their mood was better, their muscle strength, their stamina was better. But that was ignored. And that was because around that time, there were other drugs coming in. Think about antidepressant use, antipsychotic use, the anti-inflammatories, sleeping tablets, mother's little helpers, the benzodiazepines so many women were given with low testosterone. So it's just been ignored, and now it's been sensationalized as not a need to have, but a nice to have drug. And it's still thought of as a drug. Now, if I tell you that every single cell in our body responds to testosterone, that testosterone is also made in our brains, it's not just produced in the testis and the ovary. It has really important biological effects for our metabolism, for our mitochondrial function, for inflammation. It's not just a sex hormone. But yes, people do find that their libido improves. But actually, is that a problem? Are we not allowed to have an orgasm or good sex? I'm sorry to talk about that on a podcast,
No.
but there is that whole thing, isn't it? Like James Smith on testosterone, does that mean he can't get a hard-on? It's irrelevant. Does that mean that you've got brain fog? Does that mean you've got increased inflammation in your body? Does that mean you're allowed a choice? And I think, if you give and I prescribe a lot of testosterone, but I'm giving it back to a physiological response. And we know testosterone starts to decline in women in the late 20s, early 30s. So we don't have to wait till we're 50 to start taking it. But I'm not giving people mega doses. I'm not, giving them higher levels than they should be having in their body. And this is this misunderstanding, nor am I giving synthetic testosterone, which has the risks. But it's been lumped together, and that's been the real confusion.
Do you know what was scary was when I started using a TRT service, I looked at my dose for the first time with any objectivity when I used to abuse anabolic steroids in my younger 20s. First of all, I couldn't believe how much smaller the plunger was. And then I was thinking, okay, I used to use a big plunger and I'm pretty sure I used to pull back to 1. I now know that was 1 milliliter. So I never knew. The time I was taking it for bodybuilding purposes, I never knew. Then I now know the strength through the 200 or 250. And I was thinking to myself, oh my God, how much was I taking back then? Because the bodybuilder in question that I used to bite off when I was in my early 20s, he didn't tell me how much testosterone I was taking. He told me where to pull the plunger back to. And then, like you say, there are testosterone derivatives. We've got Masteron, Primobolan. We've got orals like Anavar, Dianabol. And it's almost like a menu of all different things that do different things. And, the Masteron will help you get that dry look, which I don't think I've ever been lean enough to know what a dry look is. Then the Primobolan, they talk about all of these different shapes and sculpting, and they're all derivatives of the same thing, testosterone. But the interesting thing that you say here is about how people do say estrogen women, testosterone male. But what a lot of people may not realize is as a man that takes testosterone, or even a bodybuilder that takes testosterone, estrogen management is very important. But actually, estrogen is very important for muscle growth.
Yeah, of course it is. I mean, I've just done a podcast with a professor from New Orleans, and he's a male professor, and he prescribes testosterone to men and women, and talking about the importance of estradiol in men as well. It's a really, really important hormone, and people that take aromatase inhibitors who haven't got breast cancer, it's like, why would you do that? Why
Just
would
quickly
you stop?
there. So I think I'm being, quite basic calling it estrogen when it's technically estradiol. And that would come up in blood work as E2.
Yes. So,
But am I incorrectly saying that by differentiating them or converging them to be the same?
I'm a bit sort of anal that I really want to be really precise, because we've got different types of estrogen.
Yeah.
So the main types that we've got are estradiol and estrone. So estrone is the inflammatory type of estrogen that women and men produce from fat cells. It's not a nice type of estrogen, but our body produces more if we don't have estradiol in our bodies. Do you see what I mean? So I think it is really important, because when people say for men, oh, look, he's got man boobs because he's got high estrogen, he's probably got high estrone, which is contributing to his type 2 diabetes, his hypertension, his cardiovascular disease risk. If he had some testosterone, some of it would be aromatase to estradiol, and he would look completely different.
So from the
You see what I mean?
point of here on in, I'm going to try and call it estradiol because
Yeah.
I think I've been trying to dumb it down and talk in maybe bro terms.
Yeah, but I think it's important because, like, I've never been involved in the bodybuilding sort of, the stuff that you did in the 20s. But when I think about what some people are taking with different drugs, they think estrogen is the same and it's bad for men, and it's not bad for men.
And
the
this-
estradiol is
This
bad
is great
for
to
men.
get into because this is one of the 3 hesitations that we see with reluctance for men to take testosterone. One is fertility, which we'll get into in a bit.
Yeah,
The second would probably be stigma, but the third would definitely be surrounding estradiol and
Yeah.
some of the side effects.
yeah.
So very briefly and simply, testosterone use and abuse are incredibly different.
Yeah.
Same way that
Completely different.
any type of use and abuse is very different. Having a glass of wine at the weekend versus being a full-blown alcoholic, nothing.
But again, it's different to wine. Sorry to interrupt, because you're still doing the same amount. You're still doing the same wine. You're just drinking more of it. With the other thing, a lot of it is you're having the Chicken-Flavour crisp. You're not having testosterone. It shouldn't even be called testosterone. It should be called, that's why I say synthetic testosterone. It should be called a man-made. Like, most people know about the difference between processed foods or ultra-processed foods and organic foods. So you're having the, and I prescribe the organic testosterone, not the, synthetic
Let's get into-
process.
let's
Do you
get
see what I
into that.
mean? 'Cause
Yeah,
it's
yeah,
very different metabolically in the body.
So should I take a certain amount? I'll be rough here. If I was to take and this is different between people. If I was to take 140 milligrams of testosterone, an anthate a week, it could take my free testosterone to 700. And we could say across the board that 700 free testosterone. And that could be a physiological range considered healthy, normal, and I'm pretty sure that the Endocrinologist Society would be happy for me to say that. We'll see. Now, if then men start to abuse that and go, oh, cool, if I feel this good at 150, I'm going to take 300. They take 300. The process that you referred to there, aromatization, is the body converting testosterone, or could we call it excess testosterone, or would you say an
What
abundance?
happens in any testosterone?
So it's testosterone being converted into estradiol,
Yep.
and there is a hormone present. I know this sounds complex, but it gets easy. Aromatase is the hormone that...
It's an enzyme. It's not a hormone, it's
sorry.
an enzyme.
And it's an enzyme that lives
It's like
in...
a chemical converter, if you like.
an enzyme, chemical converter that lives in body fat.
But it also is in our brain, it's in our tissues, it's in our muscles, it's all around our bodies.
And I would be right in saying that the higher someone's body fat percentage is, the likeliness of them to aromatize testosterone into estradiol is increased.
No, I don't think so, but I might be wrong. But I don't think so. But I think the likelihood to aromatase and convert into estrone increases.
Okay.
Because you still get estrone from testosterone as well. And there are lots of different enzymes, lots of different pathways. But once we've got more fat cells, our fat cells produce estrone, but they produce a whole load of inflammatory cytokines, so chemicals that are damaging our tissue. Years ago, when I was a medical student, people thought the fat cell was just blubber. It was just like an inactive thing that was a bit annoying. But actually, especially the fat that's around our organs that increases risk of, inflammatory diseases is very, very metabolically active. So what we all want to do is switch on our muscles and switch off our fat. And estrone is part of that. It's not the whole picture.
So I find this fascinating. So another thing I want to look into, and we'll get into it, I'm sure. When men considering using testosterone replacement therapy,
Yeah.
their composition often is taken into account, because we could argue that if you're out of shape, highly inflamed, overweight,
Yeah.
giving you testosterone could then bring a myriad of other issues in because of the way that estrone could affect the body through, let's look at development of breast tissue, gynecomastia, am I pronouncing that?
Gynecomastia.
Gynecomastia. So some men go, no, testosterone equals developing breast tissue, but really there's a whole
you
environment.
see, firstly, just for complete clarification, I do not prescribe testosterone for men, but I know about physiology and, I know about men's physiology as well. So I haven't got the clinical experience like I do with women, but I have the knowledge and actually common sense too. Men generally, this is a generalization, who are overweight, inflammatory people, so they're overweight, might have pre-diabetes, metabolic syndrome, might have type 2 diabetes, raised blood pressure, a bit sluggish. We see them walking down the street all the time. Those would all benefit from testosterone. But they really should have the natural testosterone, like the Testogel, transdermal testosterone. It stays as testosterone, doesn't have any esters, doesn't have any chemical additions to it. And then quite often with those, especially if they're young men, once the testosterone works, it will help improve their metabolism, will help reduce inflammation, it will help them feel better. Again, that's not a bad thing to feel better. They're far more likely to get off their backsides in the evening and go to the gym. They're far more likely to sleep better. They're far more likely to think better about their food and eat better. So testosterone is often a catalyst to help them really improve their lifestyle. And then you see them losing weight, you see them more active, you see them more engaged with life, and then their testes might then just work again, and they might not need testosterone forever. Do you see what I mean?
This is a conversation that I definitely had. I said to people close to me that I'm going to be starting to use testosterone. They said, why not just clean up your diet and lifestyle a bit more? And I said, well, if I start testosterone, I probably will clean up my lifestyle and diet more. Yeah. And I said that the chicken and egg isn't quite so simple.
It's really important, James, because, there's lots of people, and this is thinking about women as well, who say, oh, these women who complain about their brain fog, they're putting on weight, they're not exercising. If they had better diets, if they exercised more, then they'd feel better and they wouldn't need hormones, they wouldn't need testosterone. Now, my personal experience, but also my experience of seeing thousands of women as a doctor, is that most of us try really hard. Like 10 years ago, before I started hormones, I couldn't do yoga because I had a lot of muscle and joint stiffness, and it was just not a nice practice to do. I just couldn't be bothered. I didn't want to get up. I didn't enjoy my life. I was putting on a bit of weight. And I eat really healthily. I don't drink alcohol. I don't smoke. I get migraines, so I'm really careful what I eat. So what else could I do? And that's the same with some men as well. Like it's not their fault that they've got into this, but actually why deny giving them a hormone, a natural hormone that's beneficial? And about 20 years ago, on our guidelines in general practice, we had to measure testosterone levels as part of a type 2 diabetes review. So if a man came in with type 2 diabetes, obviously you measure their glucose level, you measure their cholesterol, you do their blood pressure. We had to measure testosterone. And I kid you not, it always came back low. So I'd be going, oh, can I treat them? Can I treat them? Oh, no, you have to refer them to an endocrinologist. Endocrinologist will go, oh, no, you don't want testosterone. So then after about 6 months, they said, oh, don't bother testing it. I mean, what a missed opportunity, because we know that it will help the whole, way that the insulin works in the body, and it will help probably improve their diabetes control better than other drugs.
What's interesting as well is I've been speaking to you on and off for years, and we'd spoken about the fact that women would be more likely to prescribe antidepressants than they would be hormone replacement therapy. Now, late end of 2023, maybe 2023, I hit a period in my life where, if you'd see me from the outside, like my business is performing well, my relationship is good, I've got a house, got a dog, everything from the outside was going well, but there was something just a little bit off. And if you look at my YouTube at that period, I tried peptides, I tried...
I did, I was watching you, I was worried about you.
I tried all kinds of different things, whether it was, growth, IGF-1, ipamorelin, CJC. I was buying anything I could, and it was almost under the guise of trying to feel better, but I was kind of saying to myself, it's for YouTube. Then it still didn't clock to me when I started therapy that there was something off. I was like, I'm just a bit flat at the moment. I thought maybe it's because I moved away from my friends. I even said to some of my friends, maybe it's because I'm not hanging out with the boys as much. I was creating any kind of thing that I could to explain the fact that my libido was down. Maybe I'm not, in that masculine energy of living in a house with the boys. And then there was something happening in my personal life to the point that I said, I'm going to get a test to test my testosterone. I then left it for 7 months. I did nothing with it. It's almost as if I didn't want to look. Now, when my results came back, the internet is also appalled at the fact that with free testosterone of, I think it was 313, which in some places would actually say that I don't qualify for TRT. They would say, no, you should have waited until it went down a fraction of a percent and then you would have been qualified or whatever. Then I started the cream, and using testosterone cream, whether it placebo or not, it actually wasn't physical. And even my gym lifts have only probably marginally increased by about 10%. But it was mood, it was energy, it was libido, but also it was mental health. And my business partner, one of them closest to me, he said, you're so much less anxious. And he said, he saw it, he obviously didn't want to say to me, he was like, I've known you for 10 years, you've never been anxious. He was like, the last year and a half, you've been portraying anxious traits to me. he's doing therapy as well. I hated therapy for the record. But it was only then when I started taking testosterone that I realized I'd found the answer to all the problems. And that sounds like a sales pitch. That sounds like people go, he's just trying to flog a drug because I've become an advocate to it. But all of those things that I was trying to fix were fixed.
Yeah, no.
And even now, when I come back, so many people that talk to me, it sounds as if I'm trying to, convert them to a cult. But the experience.
No, when I get the same criticisms, but I didn't know women produce testosterone about 15 years ago because no one had taught me. Then it was mentioned in some guidelines. I was like, oh God, I better read about this. And, my clinic's been going for 10 years. I've seen thousands of women, many, probably hundreds, who've come from psychiatric hospitals, who've had antidepressants, antipsychotics, they've had electroconvulsive therapy, they've had lithium. Some of them now are having ketamine infusions for their treatment-resistant depression. But they've also got hormonal changes and they've got low testosterone. And most of them will improve a little on HRT, but they'll improve significantly on testosterone. And then I've gone back and read all the literature, and testosterone can help with mental health, it can help with depression, it can help with psychosis. It's a neurosteroid, it works in our brain. So it's not like a placebo because it has a physiological response in the brain. But I see it time and time again. And these are extreme women who have been sectioned, have had the most harrowing life, and no one's thought about hormones. But the most common symptom in our clinic, but also with Balance app, we've had hundreds of thousands of people monitoring their symptoms. And the commonest symptoms are low mood, irritability, poor concentration, this feeling of low self-worth, low self-esteem. Like, you can't tell people necessarily you feel like that, but it's you just don't feel like yourself. And everything else is fine. But society is set up to just gaslight us and go, oh, well, James, look at you, you're really busy. And it's very isolating when you're also in the public domain to say, actually, I don't feel right, and something's not right. And, a lot of women say to me, I feel like I've got a chemical imbalance, something's not right. And, as a doctor, when I prescribe an antidepressant, I don't do it based on a blood level. I don't do it based on a scan result. I do it based on a history. And I'm like, what else is going on in this person's life? Are they clinically depressed or not? With testosterone, there's this fixation on the levels. Like, if you measure your level, and I've measured my level 8 times in a day of testosterone. One time of the day, it was slightly raised. One time of the day, it was really low. So if I don't doctor myself, but, if I'd shown my doctor my high result, they would have said, oh, reduce your dose. If I'd shown another doctor my low result, they would have gone, oh, you can use a bit more. Now, I'm very grateful. I feel fine on the dose that I use, so I wouldn't change it. But blood tests are only a guide. What we do as doctors is we listen to our patients and we go through options and we talk to them and involve them. And I could, say to a patient, look, it could be testosterone, it could be something else, but I know testosterone is just a natural hormone. It's a low dose I'm giving you. It has a very low incidence of side effects. The risks really aren't there because the risks are with the synthetic testosterone. So let me give it to you for 3 to 6 months, review your blood tests, review you, and then we'll decide if you're going to continue it. Like, what is the harm of that?
What's interesting there you say about the people that are really at that low end spectrum of mental health. And this is the point I was trying to make to people. I was like, I wasn't actually anywhere near there.
No.
And if I'd never got treatment, I don't think I ever would have had suicidal ideation. Yeah. I don't think I would have had a mental outbreak. I would have just been a less happy version of myself. And I would say that looking at all my late 20s, I was like an 8, 9 out of 10 on the happiness scale, always have been. So then when I found myself at a 4 or 5, although to the outside, I was probably happier than some other people still, but it wasn't what I was used to. The energy wasn't what I was used to. And then obviously it's not going to be the same for everyone else, but the main thing I would say I've got from it is aggression, in the sense that I'm more of a go-getter now. I wake up, I'm like, let's go do this, let's go do this, let's go do this. I want to get more done. The aggression is, I'm going to go train, I'm going to go do this.
Is that a bad thing though?
To some people, I think it could be, and this is my theory. So I never really understood what status was until the last few years, been reading a few of Will Storr's books, and people become very threatened, especially in the male landscape, with other people's status. And the easiest way I can explain this to someone is, if you give someone a pay rise, it'll make them happy. This is from Will. But if you give that person a pay rise and everyone else, they're not happy. Because status is about being ahead of everyone else, not them being ahead with you. So if you give TRT to a man in a group of 10 friends and he starts to look better, feel better, improves his confidence, he starts training more, that makes the other men feel like shit because he is accruing status that they're not. He is getting the pay rise while everyone else in the department doesn't. And because of that, I think men feel threatened, especially those of which that won the genetic lottery. So if you've won the genetic lottery and you've got an incredible hairline, you're 6 foot and you're in shape, and now suddenly these inferior humans are now benching the same as you and developing a set of deltoids, you feel threatened because status is really the only currency you have for access to resources, access to mates, if whatever it is. And another kind of avenue I want to look into this in is when it looks at like weight loss, because weight loss, what we're trying to do with hormone replacement is one thing, but another world that's come along since we last spoke is probably weight loss medications, GLP-1s. Where are you at with these? What do you think of them? What's your stance? How are these helping people, hindering people? I have my opinion, but I want to know yours.
So firstly, I don't prescribe them. I'm a very slow adopter to new drugs. I mean, I know the whole world think that I'm really maverick and I'm doing all this stuff with hormones, but this we've got data for hundreds of years about hormones because they're natural substances. GLP-1s, they do have a role for some people, so I'm not dissing them completely. But, you know, I speak to people who are my size and just want to get into their bikini and they want to use it, and I do think there's a bit of a problem. I also, as a woman who had a bit of an eating disorder in her teens, I'm constantly thinking about my weight. Like it's there. I've got this noise in the background. But actually I realised that there's better things in me about what my body shape is. Do you know what I mean? But I see so many women struggling with their weight, but their hormones aren't balanced. So I always say to my patients, look, let me balance your hormones because all 3 of them will have an effect on your metabolism. They'll have effect on your weight, their ability to build muscle as well. As you know, muscle's metabolically active. If you've got more muscle, you'll probably lose weight as well, and the ability to exercise. Some of our data we recently published showed that 73% of women who use testosterone are more likely to exercise, like comparing the same people before and after testosterone. You know, so that's not a bad thing either. So I always say to people, let's balance your hormones, let's look at your nutrition, let's look at your alcohol, everything else together, and then wait 3 to 6 months because nothing happens overnight. And then if you want to do GLP-1s, whatever, I'm not going to give them to you, but you've got to do things. I always think, let's just rebalance people physiologically. Because I see people, like younger people as well, who are having a crap diet. Like, they're not doing any exercise. They're on contraceptives, so they're blocking their hormones. And they're just using GLP-1s, which actually are quite expensive as well. So that's just where my head is with them, really.
So I was very anti them to begin with. And I completely agree. I think it's terrible that people that aren't weight training, eating well, would consider these. I had an umbilical hernia last year, which was a very weird thing.
I've had one of those.
I was in bed and I kind of felt a little lump in my belly button. Being a man, I was like, I'm obviously dying.
Yeah, of course.
Went to see a specialist. They're like, got an umbilical hernia. I said, cool, how are we fixing it? He said, come back when it's worse. I was like, do I need to cover it up or anything? He was a specialist. He poked me in the belly button and went, come back when it's worse. He goes, if I do it now, I'll have to give you a stitch. If it gets worse, I'll give you a mesh. He said, I'd rather give you a mesh. It's like, okay. So I thought it'd be a couple of months. It turns out to be a year, just over a year, which was annoying because I had to get another referral. And there was one point where I was sitting up on the sofa and I was like, oh, that's got bigger, probably from jiu-jitsu. And I couldn't get it back in, couldn't get my insides back in. And it was horrible.
Yeah,
so I'm kind of wiggling around and everyone's like, what are you doing? I was like, I'm just pushing my insides back in, don't worry. And then I knew that I would have to stop training because I didn't want to have a really bad hernia, but it was only a bit of fat tissue.
Yeah.
The bad ones are where your intestines come out. Joey from Friends or whatever anyone's thinking about. And it wasn't very urgent. But at that point, stop training. At that point, I knew I was having surgery. At that point, my weight starts to balloon. Because I don't give a shit. I'm about to have surgery. I'm about to be out of training for 12 weeks. I wouldn't say I was depressed or low mood or whatever. I was kind of just a bit, what's going to happen? So as my weight's gaining and I know surgery's coming, I tried semaglutide before for a YouTube video. I ordered Manjaro, tirzepatide. And I thought this would be an experiment, whatever, at the same time. My weight was over 100 kilograms. So my BMI was about 30. I legitimately qualified before anyone starts getting angry in the comments. And week 1, I couldn't believe the impact it had to not just my appetite, but my mind. It felt very calming. I might have some kind of mental disorder like ADHD or some kind of dopamine addiction or whatever it is. And it definitely changed my approach to the drug. Now, the weird thing is that calming effect didn't just get me to eat less, it got me to eat better. And the weird thing is, there's a breakfast place I go to all the time, and this isn't going to be the same for everyone. And usually I have bacon, I'd have eggs, I'd have like a bit of halloumi or whatever. I was craving a tomato with my eggs. And I was like, oh, I might have some tomatoes with it. I was like, who's this person? It was not finishing meals. It was having control. If I was asked, oh, do you want a bit of chocolate after dinner? I'd say yes to be normal, but I didn't actually want it. I would go out for dinners and I wouldn't abuse the entrees. I'd enjoy my main more. The weird thing is, on tirzepatide, personally, I enjoy food more because it's not emotional. It's not a rush to the end.
Were you on testosterone then?
Yes.
Yeah.
And that definitely played a part through muscle preservation, mood, energy, and even being in a severe calorie deficit. It wasn't severe. I'd probably say my calories were down 30%. I hear about some people losing huge amounts of weight.
Yeah.
For me, it was quite a slow decline because I think my baseline appetite is so insane that it was in that position. So taking that for me, I did it for 2 months. I probably lost 3-4 kilograms. It was actually a preventative to stop me gaining weight. But it definitely changed my approach to when I see probably the whole world of obesity as a whole. But it was calming. It was nice to know that I could administer something and I didn't have to think about it. I didn't have to obsess over it. It was also very strange for me to, at the end of those 2 months, see a picture of myself topless that I liked that didn't have any trauma of restriction before it. Now, this way you say about eating disorders, I completely agree. There have been negatives since that when I've now gone to what I would consider baseline, I feel a bit pudgy. Which that is not a good position to be in. But the one thing that concerned me the most was how much it improved my blood work. I'm now someone that religiously looks at my blood work. If I see my LDL moves into the red, I'm looking at citrus bergamot, I'm taking all these supplements, and I'm now trying to find out what works and what doesn't. My cholesterol, my CRP, my every single metric on my blood work objectively improved whilst taking tirzepatide. So now I'm in a dilemma where I'm thinking, is this, quote unquote, potentially a net healthy decision for me to do? I'm in a dilemma. And again, I'm trying to build my own argument. Maybe I'm saying that just because I like being leaner without effort. Maybe I'm saying that because I don't want to put in the effort or the mental cognitive function into tracking calories. So I'm an advocate for them. Do I think that people in my shape and age? I'm not sure. For the injury thing, though, there's a whole ethical debate. What are we going to do? Say, oh, you've done your ACL, get the weight loss drugs out. I don't know where I'm at with it, but for me, I've gone full circle. And if I'm completely honest, if someone was to say to me, I've got a friend who's 140 kilograms, they really need help losing weight, I'd probably send them to a GP more than my training app.
Yeah. I mean, my husband's a surgeon and he sees people with BMIs of 50, 60 needing an operation. And they can't lose weight, or they say they can't lose weight. And there's a role there. I was a medical student when they started doing gastric banding. And we thought it was the best thing ever because people would lose weight, it'd be brilliant. And then you realise that they had a lot of, nutritional deficiencies, a lot of vitamin deficiencies. They were liquidising their Quavers crisp to get them into a little thimbleful so they could still get that flavour. And, there's the other side of any medicine, because it is a medicine, looking at the risks as well. I had pancreatitis about 20 years ago and it was the illest I've ever been. It was the most horrendous thing. And I was really worried it was going to become so worse that I was going to end up in intensive care. Pancreatitis is a side effect of these drugs. I've got a friend who's a gastrointestinal surgeon, and he says every time he's on call, he sees people with pancreatitis who are awful vomiting. So he's seeing some of the side effects, but that doesn't mean that everyone's going to get them. So it's like anything in medicine, it's a balance. We don't have the really good long-term data. I've got some really close friends who are colleagues in America, and they've got a lot more experience than we have over here with them. So I think it's like anything, there's a role, but it shouldn't be just the go-to. And what I don't think it should do is to be a substitute for good lifestyle. And what we should be doing is spending the money that we get on these drugs into teaching children how to eat properly and trying to get rid of some of the processed foods and everything else. I know it's a different conversation and different budgets, but we're using it to treat a problem that we've created ourselves for a lot of people, not for everybody. So, but I think like anything in medicine, nothing should be done in isolation. There's this whole thing that I prescribe HRT and I think HRT is all we should do. Like, of course I don't. As a doctor, we have to be looking, are there any other medications? But the other thing is, we deprescribe a lot. So we've just published some data, and we're writing up some more of our data, that women who take hormones, we can reduce their antidepressants, their painkillers, their gabapentin, their pregabalin. Like, that's really important as well. If they have testosterone with their HRT, we can reduce them more. So as a doctor, I know it's a bit weird saying I want to reduce medication, but we have to be thinking about that as well.
Isn't it annoying when people interrupt your podcast to promote random crap and spend a minute talking about the benefits? I respect your time, so I'll do it in 12 seconds. These are some of our Newtonic products, and they're really good. So please head to Newtonic.com and find out for yourself. Right, let's go back to the episode now. Don't forget, Newtonic.com. So men who exogenously take testosterone will see a downregulation of the testes. They will stop producing testosterone themselves, which is kind of a really bad thing, and you're going to make yourself infertile, and you're going to, ruin your chance to have kids. That's actually often probably the first question. Someone says, should I consider HRT? Should I consider TRT? You say to them, have you had kids? That's the kind of discussion in the man side of things. And there are fertility medications that people could take, such as one I'm taking now, HCG, which I'd be interested to know. I've seen mixed bags on it, where people say you should only take it if you're trying to have kids, and some people say you should take it to keep yourself online, quote unquote. But about a woman, let's say you've got a 22, 23-year-old woman who could benefit from taking testosterone, would she see the same issue to her fertility?
So this is really interesting, actually, because I don't really argue with my husband, but it's one thing that I do have quite discussions about, because I don't understand the data here, because testosterone improves fertility in women. We know it improves ovulation, it improves fertility in women. We know that women who, with POI, premature ovarian insufficiency, so women under the age of 40 that have an early menopause, if we give them hormones including testosterone, they're more likely to conceive. But then you're quite rightly saying, but with men. But I'm not aware of the data really, because anything I've read about testosterone and fertility is with giving synthetic testosterone. So if I give a woman a synthetic estrogen and a synthetic progesterone, that is contraception. Of course it is. That's how it works, because it blocks the natural hormones working. So, and again, I'm only talking theoretically because I don't prescribe for men, but if a man has a synthetic testosterone, it's going to block their own testosterone working. So therefore, they won't have their own endogenous testosterone. They will become infertile, because it's like a male contraceptive, but no one thinks about it in that way, but it is. If you have natural testosterone, it's the same chemical structure as the testosterone your testis is producing. I know people say about this negative feedback, and it might be while you take it, but who's done the real studies just with the natural testosterone? I don't think anyone has. And how does your body really know the difference? And, it doesn't really just sit right in my mind. And this is where, we always talk about there's not enough studies in women, but there's not enough studies in men. And we really need to be looking at this subset of men, because I think they're probably, don't want to be shot, incorrectly told that blanket all testosterone treatments will cause infertility. And I think, I don't understand how it can. Do you see what I mean? Just as a physiological way.
So we're now kind of saying to people, if you want the benefits from using TRT, we're kind of only really looking at childbearing age and above. And actually, that's the crazy thing. The comments on a YouTube video, you're only 36, what the hell are you doing on testosterone? When you could argue there are a lot of men in their 20s, similar to menopause. You say to someone is going through menopause at 39, they go, no, they're not.
Well, my youngest patient's a teenager. She became 40, when she was 14, she became menopausal, her ovaries didn't develop. I see a lot of women in their 20s with testosterone deficiency. But I had a patient recently in my clinic, she's 23 now. I first saw her a year ago with really bad PMDD, really bad. She couldn't get out of the house, really struggling. Started her with progesterone, she started to feel better, but her testosterone level was really low as well. So over the year, I've given her all 3 hormones, and she's lost 7 kilograms in weight. She's changed her diet completely. She's not drinking alcohol. She's not having any processed food. She feels wonderful. But when I saw her a couple of weeks ago, she said, I'm getting a few spots, and I'm not sure I don't feel as great as I did. Her blood work showed that actually her hormone levels had gone high. I said, you know what, your ovaries started working again, because you've reduced your inflammation, I've supported your health, your ovaries. And I'm sure men would be like this as well. I've said about those overweight men who are a bit resistant, who don't need testosterone in the long term. And it is, you know, our bodies are changing all the time. Our hormones are interacting all the time. And you could argue, oh, well, she could have lost 7 kilograms herself. She could have whatever. But her mental health wasn't in the right place. Her physical health wasn't. So those hormones have supported her. And that's why, you know, as a doctor, when I prescribe hormones, I'm monitoring people. I'm not saying, there you go, have your testosterone, have a nice life, and I'll see you around. And it's the same with men. You're constantly monitoring as well. So I just can't quite work out in my mind about this male fertility.
So should men be having a discussion with the clinics or their GPs about whether or not they're being given synthetic or natural testosterone? So. And are there pros and cons to both? And the administration of, let's say, a natural testosterone, you said before about Testogel. So are we looking at transdermal applications?
Yeah. So the transdermal applications.
Which means through the skin.
Through the skin, absolutely. So the Testogel is testosterone, but the injectables and the oral, it's not really given so much for men anyway because of the liver damage. The injectables are synthetic, but there are different types of injectables.
And that's because I believe that doctors will prescribe different forms of injectables because you get a very long chain, let's say, to slow releasing type of testosterone. For instance, my dad had an operation on his pituitary gland when he was younger, and he's been on testosterone, quote unquote, but he gets a jab like every 3 months. I like to inject 3 times a week or sometimes every other day because I want to get the peaks and troughs of testosterone as small as possible. For me, that's fine. I'm not bothered. But I would be using a synthetic form. For me, and I'm not sure for other people, if they were going to use transdermal testosterone, there is potentially an issue of contamination.
That's just rubbish. My husband, I don't know if it's too late, I've said it now. My husband uses testosterone, but he uses a Testogel. So every morning he's slapping it on and it gets absorbed. He puts his clothes on. Contamination with who?
So I remember at the time my partner was pregnant. So
yeah, but she'll have testosterone in her body. Like, do you know what I mean? Are you going to squirt it on her?
Someone actually said a little bit will be fine. She might even feel better.
I mean, this is, you know, when he's got his gel all over his body, I'm not naked going up to and hugging him because that's a bit weird, isn't it? Do you know what I mean? He's getting ready for work and that's just... So I think we just have to be a bit careful. This contamination of a natural hormone with someone else who's got a natural hormone in their body.
It's largely bollocks.
Well, yeah.
That's interesting. So,
you know, I mean, if your son like ran around and put it on him, I would be a bit concerned. But you're not going to give it to him to play with. So, do you know what I mean? It's sort of.
So I'm not asking for medical advice here, but you saying that potentially through men out there wanting to be fertility minded, rather than using a synthetic drug that potentially is going to make you infertile and running a fertility drug alongside it, you could just run.
Well, like the studies aren't there, so don't quote me with this. But this is where my head's thinking because it's the same with women, and I don't really understand. And I was at a urology conference in Perth last year, and I asked this question, and literally these urologists were like, "What are you saying? What are you saying?" And I went, "Oh, I'm just, you know, I have this discussion with my husband a lot." Then they realised who my husband was because he's a urologist. They were really friendly with me, but they still like that's the way they've been taught. And in medicine, if I've been taught something, like if I've been taught HRT is dangerous, it's always dangerous. I won't think about it. Well, I do, but lots of people don't. And it's the same with testosterone. So I don't think we've got the answer. And that's the whole thing. But the other thing is, testosterone, as you know, especially through the skin gel, doesn't last in the body for very long. So if I stop using my testosterone today, I'll pretty much have none in my body tomorrow. So then my body will either start working again or not. We've had this debate for years about contraception. You know, when I was a junior doctor, they used to say, when people come off the pill, wait 3 months and then they can start to try and conceive. And then they went, oh no, your fertility might be better as soon as you've stopped. Just go for it and don't use condoms. But no one really knows because we're all different.
Yeah, here's something, this is not backed by science. Anecdotally, a lot of my friends that are running synthetic testosterones that run HCG haven't had too many issues getting pregnant, but they seem to have girls. So 3 out of 3 that I know in the last 3 months. So I'm just saying out there.
3 out of 3, like that might just be.
Potentially, yeah, but that's my close cohort study, double blind. So for anyone out there, I'm just saying, if you end up having a girl, that could be why. So incredibly interesting. I want to come back to amenorrhea because we just went to the menstrual cycle. We talked about fertility. We've gone full circle. Amenorrhea, discontinuation of the menstrual cycle. In most cases that I've experienced over time is through inadequate nutrition, inadequate calories. Actually, are those two things the same or interchangeable? Is it a calories thing? Is it a nutrition thing? What's going on here? Should women be worried about it? And what are the implications to fertility?
Yeah. So it's really important that if someone doesn't have periods, we need to be thinking why. There's lots of reasons why. It could be pituitary like your dad, it could be something else going on. But we need to know, because if your hormones are low, that means you haven't got those beneficial hormones in the body. So the hormones estrogen, progesterone, testosterone are anti-inflammatory. They work in every single cell. They're really important. Our bodies as women are designed, like I said before, to get pregnant. If we have any insult on our bodies, one of the first things our bodies do is protect us from getting pregnant, because you don't want to be pregnant if we're not in the best shape ourselves. So if someone's got an eating disorder, they're nutritionally not sound, if they're really underweight. But one of my daughters had sepsis a few years ago, and her period stopped for a year because she had this massive insult. She was really poorly. Like, the body stops. And a lot of athletes I speak to go, oh, it's great, I don't have a period. It's not great, because their risk of osteoporosis, their risk of heart disease, their risk of dementia, the risk of lots of inflammatory diseases really increases. They're worried, especially if it's an eating disorder, that they're going to put on weight if they go on any hormones. But actually they often don't. They feel better, they feel stronger, they feel mentally better. A lot of people, again, have low testosterone if they've got an eating disorder. And the psychiatrists, especially the ones who are inpatients, really severe, they're giving them all these chemical drugs, the antipsychotics, that will make their hormones even worse. So hormones are really, really important. And a lot of people are then said, oh, if you haven't got a period, let's just go on contraception because that's a hormone. But hopefully, if people have listened this far, they'll know that it's not the same as the natural hormones. So it's really important. I worry a lot about young people without hormones.
I think I've personally talked to over 100 women out of competing. And I've been crass, I've been vulgar, and I've said to them, to some points, if your menstrual cycle stops, take a fucking hint, because your body's saying, you're not going to survive pregnancy. And that should be a bit of alarm bells. But what annoys me is that some competition coaches will diet them so aggressively to get the menstrual cycle out of the way.
Yeah, totally.
And then it's a straight shot to the 12 weeks to step in on stage. And what I hate is that even the fact that these bodybuilders, and again, we could argue that men could get to six-pack shredded with less physiological downsides, but most of them can't get their dick hard if they're natural. Yeah. And they're parading themselves to the point they look so much like shit, the bodybuilders get annoyed, that we cover them in fake tan, and those smiles aren't real. They're thinking about the donut that they're going to have or the meals that they've frozen beforehand for a fucking pro card so they can get a few more PT clients. So their audience can, go, oh, well done, you didn't eat for 12 weeks. We're literally glorifying starvation. No offense, it's fucking pathetic.
Yeah, but you look at some of them, the subcutaneous fat is non-existent. We do need fat in our bodies. We need cholesterol in our bodies. It's anything in extreme is not right. We have to ask ourselves why, but especially when it has an impact on hormones.
The majority of, even though the women influencers I know that compete and made a career out of competing, they all retired because they were shit scared they were never going to be able to have kids. But they don't say that to their audience because they've got to sell them bikini plans.
Yeah.
And it's a worrying place. Now, we spoke about you at the conference, people attacking you. If you're comfortable to talk about it, I saw some controversy online and I was annoyed. People were gunning for you. I had even some of my good friends that are doctors sending me the reels being, and I'm like, give me context. What's happened? This is your opportunity, because I don't know too much about it. I didn't watch any documentaries or read any news articles because I could tell from the title alone that it was trying to mislead people.
I don't want to go into too much detail, but it's become really sad because a lot of it is misunderstanding of who I am. A lot of it is other medics. And, I went into medicine. Like, I'm not from a medical background at all. Like, no one in my family is medic. My dad died when I was 9. I was so sad he died. I wanted to do medicine before, but it made me want to do medicine even more because I don't want other people to go through what I did at such a young age. So I'm a really caring person. Like, I really like my patients. I've worked in really deprived areas. I'm not judgmental. I'm clever. I'm hardworking. I'm work far too hard. But I've come into this sort of menopause space over the last 10 years, really shocked with the stories that I've heard. And when your things blow up, people are like, I'm sure you get the same DMs and messages from women saying, no one's believing me, no one's listening to me, I'm on antidepressants, I want to end my life, I've left my partner. And I'm like, God, this is awful, actually. So when I feel a bit this is awful. Like you, I've just got a fire in my belly and I'm like, I want to help. And one of the good or bad things about social media and media is that you can reach people. Like we wouldn't have even connected if it was 30 years ago. Do you know what I mean? We wouldn't have followed each other. You wouldn't have put that book on your holiday, you know, all that stuff. So I've just been out there going, look, guys, but I've also been out there not just talking about flushes and sweats, not just talking about periods. I've been out there talking about the role of hormones in your brain. I've been talking about inflammation. I've been talking about mitochondrial function. I've been talking in ways that probably people haven't really joined the dots and thought about hormones before. And, you know, wrongly or rightly, I have got a lot of public support, but I'm not doing it for me. I'm doing it for women. I don't want my children to grow up having such a shit time that so many people my age have had because their doctors haven't listened to them or haven't been trained. But historically, menopause has been like owned by gynecologists, and this is for years, since the hormones were discovered, like I say, in the 1940s. The pharmaceutical companies paid gynecologists and researchers to work together. And so people have always thought about our womb and fertility with menopause. So I come along as a GP, a general practitioner, and people are like, well, who's she? What's she doing? She's not part of us. Where's she coming from? And then I open my clinic because I want to help people. But I thought, well, actually, I don't want a busy clinic. So I'm going to develop the free Balance app. I'm going to put some of the profits into that. I'm going to do a podcast and I'll use some of the profits to pay for the podcast. I'll develop an education program for healthcare professionals, use some of the profits for the clinic to do that. I'll also do more on my social media. I'll also write some books. I'll just educate people because my mission is to improve the global health of women by them having education that they can make choices that are right for them. My mission is not for every woman to be taking testosterone. It's up to them what they do. But I've just been interpreted by the establishment. You can just see on social media, people call me just a social media influencer. Hang on, I'm a doctor, you know? I've got a first-class honours degree in pathology. I'm a member of the Royal College of Physicians. I'm a fellow of the Royal College of GPs. I've got distinction in every exam I've taken pretty much. I got bullied at school for being clever, you know. I just hang on, guys. But it's a bit like you saying that being, paid more than others. I think people see me as something different. They see me as this maverick. They see me as this, this voice that perhaps doctors shouldn't have. So rather than thinking, oh my gosh, she's onto something. Oh my gosh, look at all her peer-reviewed articles that she's had published. Look at her research. She's funding research. She doesn't work with pharmaceutical companies. She doesn't sell her own branded product. What's she doing? They're just spreading misinformation. One doctor told another doctor who I know, oh, Louise, she's loaded because her dad has got a big trust fund and all her money's from her dad. Now, my dad died with nothing. And it's stop it, actually. Come and talk to me and ask me who I am, what I am. But it's not, and it's this whisper game. And then people keep saying it's professional jealousy. And I don't really understand the word jealous because are they jealous that I work all the time? Are they jealous that my profits have all gone into everything else? Are they jealous that I'm clever? I don't really understand. So it's just been going on and on and on. And it's, there's been various things on social media, in the media, documentary made about me. And the most recent documentary was about me prescribing higher doses of hormones. Now, we've already said I prescribe them through the skin. My skin and your skin are different. We know that the skin is a barrier. That's why we don't put many drugs through it. And it's the same with Testosterone. It's the same with patches. Some women need more doses than others just to get it through the skin. My 14-year-old can understand it, but somehow this whole program is she's prescribing these dangerous doses. It's hang on, what about all the women that have got their lives back? What about all those lives I've saved? And it's not even about the clinic, my work. The women, if people recognise me, they thank me for my free app and my podcast. And a lot of women actually will thank me because I've saved their lives, because they've had the information and they've said, oh gosh, I'm not depressed, I need hormones. And then they've found the information and the treatment themselves. They haven't come to our clinic, which is really rewarding. But it's really hard. I mean, you get attacked, but it's difficult as a doctor, I suppose, because as a doctor, I'm really careful what I do. There's the General Medical Council Good Code of Conduct. One of it is being kind to your professionals. I'm never going to come on here and name and shame people. Of course I'm not. It's just but it's hard.
I've got a theory. So the first of which is that you never get put down by people above you. It just doesn't happen.
No.
So the higher you go, the more people there are beneath you. And I know this firsthand because when I started as a personal trainer, I used to always go at Joe Wicks. And it's because I was jealous of him.
Yeah.
I was jealous that I thought he shouldn't be doing as well as he is. I want, it's simple as day. I emailed him in 2014 and I said that to him. I said, you never get put down by people above you. I said, sorry, mate, I've got to get ahead a bit. I'm stuck in a gym in Bracknell, so I'm going to be gunning you a little bit. And it's difficult because then people see what you're doing and they will get a little bit jealous. Also, a small percentage of people are just psychopaths. There's nothing you can do about it. And I remember since going public about being on TRT and doing various things with it, there was a period where I got so much hate, so many unfollows, so many stuff, to the point I was like, I'm just not looking anymore. I remember one day I was kind of like, I was a bit down about it. I was thinking, should I have even done that? Was this right? I was getting all the anxiety of, have I just made a terrible move? Is this the beginning of falling off? Through all of these horrible thoughts. Then it takes time for blood test 2, all of these things. I think nearly 200 men now started TRT because of that video. And then it just took that one post in the Facebook group that said, I wasn't sure what I was going to do. Since that treatment, I feel better. This has quite literally saved my life. And I sat back and I was like, I said to that, thank God that guy put that. Not even for that, but out of all the hate I got online, for that one message, it was worth it. And I thought to myself, I don't know if he was suicidal. I don't know if he was going to do something bad. But I know that if people don't say it lightly. No one goes, oh, you just saved my life. And I remember you telling me about it when you had clients that did it. And I thought, even if 10,000 people fucking hate me for it, but one person has got his quality of life back, I was like, I can relax. I feel better. The mission can continue. But unfortunately, I think every stage in life, people are just going to have a tremendous amount of hatred. But every time I've spoken to you, had you on, referenced your book, all I hear is good things about you. You mentioned there about the Balance app, got your book here. All of these things, all the resources, I'll put links to the description. Is there anything else you'd like to tell people about?
Yeah, well, thank you, firstly, for your support. And, I have a lot of support. And actually, after the programme, the thousands of complaints and comments. And I put a statement out which had a lot of support. And, my children won't let me give up. I've been to some dark places and I've really thought, like you think, I just can't do it. Why? I just can't do it when I'm listening to this. But then I get a message and I got, my middle daughter bought me a mug with the C word on. She said, this is what these people are. You drink from there. You get back out there. And I do. I owe it to other people. But I'm doing another theatre tour. I did a theatre tour last year, which was really hard because the second date of the theatre tour was when this programme came out. So that was if I can get on the stage at 34 venues all over UK.
Did you reference it in the talk?
I didn't at the time because I didn't know where it was going.
Okay.
But actually what was interesting is the tour, the second half was all about the history of hormones. And I spoke about some people, male and female, that have been taken down, including Brown Sequard with his testosterone story. And so it was really poignant, actually, because of the timing, people could see, it's someone else being taken down. So next year, I'm going to do another big theatre tour. And, like when you do this work, when it's public facing, you can just feel the energy. There's one thing on social media, but you don't know who these people are. So I'm really looking forward to that. I'm doing a lot more with my podcast, a lot more just helping people who've got really great ideas with Balance app as well, which is a free app. There's a lot to keep me busy and a lot to keep me really focused away from all the crap that's going on.
I'll make sure I get every link and everything from you to put into the description to this. Thank you very much for coming and having a chat. I'm confident everyone's going to love that.
Thanks, James.